Hospital workers. What regrets do you hear from dying patients? I was a hospice nurse. One of my elderly patients had a skin cancer, a huge malignant melanoma on the side of his neck that was growing rapidly. He had been a farmer all of his life and never married. One night we were talking, and I asked him if there was anything he wished he had done differently in his life. And he thought about it for a minute and said that he wished he had worn a hat when he was farming. I wish he did too.
We now have a Discord. Check out the server in the link in the description.
Story 2. I work in a hospital. Whenever someone is at the end of their life, they always just want to be with their loved ones. Any regrets I've heard is always family related. They wanted more time with the people they love. Most people are at peace with things, though. People also tend to wish they took their health more seriously. Story 3. He wished he had been a better father to his daughter. He wished they had reconnected. His dementia prevented him from remembering they had reconnected years before and that she visited often. I wish I could have made him aware that he had accomplished his last wish, but he died not really understanding that. Story 4. In the ER, it's not something most people see coming when they arrive, but it's usually the same regret when they're coherent. They all wish their family was there, which sucks even more lately with COVID since family can't come in initially. Or they cry out for their significant other in a panic. It's gotten to the point recently where we just tell them that SO is right here with you. The look of relief on people's faces just hearing that gets me every time. People just want to not be alone at the end. Story 5. I had a patient who I was in the room with when her doctor explained that she only had a few weeks to live. I knew her well, spent quite a bit of time talking to her up to the news. The days that followed, she seemed to have accepted that she was dying. She lived this beautiful, independent, and successful life. Maybe not money successful, but just plain happy. Anyway, when I was helping her to the tub on day 10 since receiving the news, she just broke down crying. And couldn't stop crying about how much she wished she didn't put her dog down because they could have died together. Come to find out, her dog was on his deathbed too. I guess she put her dog down a few days before going into the hospital. She knew her life was over, so she put him down first. She hated herself for it and for the fact that she blew the opportunity for them to spend their last moments together. Really heartbreaking to watch, to hear that unfold. She passed early in the morning 2 days later. I took a couple of mental health days off after she passed and spent some time looking up dogs to adopt and new jobs to apply for. Story 6. My mom did home health and hospice. My stepdad was very abusive, and my mom would take me to work with her to try and protect me. She didn't want to leave him due to religious beliefs. That's a different story. There was an old man. I would play cards with him. We would talk about working on the farm we had. He was a nice guy. He figured out I was being physically abused. His health started declining and he couldn't play cards or get out of bed. The last time I saw him, he said he was sorry he wasn't younger and that he couldn't help me. Almost 25 years ago, and I still remember him. Just so it's clear, just so everyone knows, if I start sounding like I'm going to cry or I'm crying or something like that, that's ridiculous. It's just allergies. I'm a professional. Story 7. I remember this 40-year-old patient that I had who was dying from breast cancer that spread throughout her body. She was diagnosed with breast cancer 10 years earlier and had a mastectomy. The doctor recommended for her to have a bilateral mastectomy with reconstruction due to high risk of recurrence of cancer. She said that she wanted to keep her breast, a real breast rather than an implant, in case she remarries and will be somewhat whole. She regretted not getting the bilateral mastectomy. If she did, she wouldn't have gotten cancer in her remaining breast and dying at such a young age. The patient never ended up marrying after all. A week later, I was diagnosed with breast cancer. I instantly told the doctor that I want a bilateral mastectomy with reconstruction. I also had an aggressive form of cancer. My doctor kept pushing a lumpectomy, which I probably would have gotten before I've heard how much she regretted her decision. I feel like that she actually saved my life sharing and opening up with her regret. Story 8. I worked as an oncology nurse right out of nursing school. I was barely 21 years old. Had a patient about my age who was dying of lung cancer. A few hours before he died, I sat with him and he was telling me how much he wished he would have had more time to maybe fall in love, marry, have kids. He was so young. He asked me to call his parents and he died shortly after they arrived. It was awful. His regrets were more about the life not lived. Many older patients had some interesting life stories and most wanted to tell them before they died. Most were at peace with the life they lived. Many regretted working so much and not spending enough time with family though. Story 19. AEMT here. Most patients that I see in my ambulance are too sick to talk in these cases, but one sticks with me. Mid-40s male called us for chest pain. Put a 12 lead on and he was in the middle of a massive heart attack. For those that know the term, he was throwing tombstones. Sad part was, he had medical training, so he knew that it wasn't good. We were rushing to the hospital, and he looked me dead in the eye and goes, "I should have ate that frickin' cake." When I asked what he meant, he told me, "Screw what others think. If it makes you happy, do it. Eat the cake, pet a squirrel, take a nap, screw anyone else, it doesn't matter." He crashed shortly after we got to the ER and didn't come back. Now, at least if I want to do anything purely for the fun of it and my wife asks why I want to do it, all I have to say is I want to pet the squirrel. Edit for more information. Obligatory, please don't actually pet wild squirrels. They will not be entertained that you are messing with them, and they will put their teeth to work. Tombstones on an EKG are indicative of a massive damage being done to the muscle of the heart due to blockage, and due to electrical signals being seen actually looking like tombstones, also known as widowmakers due to the fatality rate. I couldn't tell him what his EKG said due to my level of training. I can only obtain and transmit them, not interpret them. But he asked to see it and knew what he was looking at. Story 10. I was a new nurse, flying solo. We got a call for an incoming trauma, a woman in her 50s involved in a multi-car accident. We were already at the ambulance bay, unsure of the woman's complete condition. She rolled in breathing on her own, but very labored with asymmetrical chest expansion. She was profusely bleeding, had multiple deep lacerations, pupils blown, debris covering most of her, etc. Her vitals were unstable, she was circling the drain. We knew she was on the verge of coding. I was standing near her head, ready to assist in supporting her airway, but also providing comfort and doing my best to calm her. The woman looked me directly in the eyes and said in a hoarse, labored voice, "I was angry. I told her I was disappointed in her." She began to cry, her vitals plummeted. "I'm sorry," was the last thing she said before her heart stopped. We coded her, intubated her, performed round after round of ACLS, only to eventually have to call time of death. I still see her face at times, her eyes filled with more emotional pain than physical. It took much longer and was so much harder to write this than I thought it would be. Story 11. Paramedic, but close enough. Made a run on a woman in her 30s for shortness of breath. Her and her boyfriend had just moved into an apartment together. They were fighting over something trivial. Which room to unpack first or something. He thought she was just being dramatic. We transported, and she never made it. Went from awake and talking to unresponsive and asystolic, no cardiac activity, in a matter of seconds. They were so caught up in a little argument that they never said goodbye. They never told each other they loved them. She didn't have any last words, and honestly, that's even worse. Story 12. A little different, but I worked in a GI lab, and we had a much older man, late 70s, probably maybe late 80s, it's been a while, come in for GI issues. While doing the procedure, we found cancer, and it was a death sentence. Super bad, and I think he had refused to have a colonoscopy up until this point. The doc said it was horrific. We couldn't get past the cancer, it was so bad. He said maybe a few months. We finish up and I'm at bedside with the patient. And doc comes in to talk and family wouldn't believe it. The guy wouldn't believe it. The doc backed down and not once told him how bad it actually was. I was pretty upset because Doc basically lied to the family and gave them false hope, because they wouldn't stop arguing and he just didn't care to tell them the truth. I still wonder often about what happened to him. If he spent his last days fighting it and wearing himself out, or if he let himself enjoy the last few months. Colon cancer is horrific. It looks exactly like the word cancer. It's disgusting. It looks alien. Please, 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 people, get your colonoscopy when you're told. It's not just you you're saving. It's your kids who will get screening earlier if they find something in you. But if you don't, they'll never know they're at risk. Story 13. End-of-life physician here. CPR. No, seriously, hear me out. Imagine using your hands to crush the sternum down 2 inches repeatedly of your 90-year-old grandmother who weighs 90 pounds, so that maybe you can then put her on a ventilator from which she might never get off of alive. We ask this of everyone who comes into the hospital, but too often it's asked more like, "Hey, if you're drowning, do you want us to save you?" rather than what it truly is, especially for those who most likely won't survive it in the first place. And if they do, they will be significantly worse off than before they died. The survival statistics for patients with 1 or 2 significant comorbidities with an in-hospital cardiac arrest is like less than 5% to leave alive. And then 30-day survival is 5% of that original 5%, if I remember correctly. I cannot count the number of times families were adamant on having it done to their loved one, only to then see what it entails firsthand, and then beg us to not do it again. I remember at my great aunt's house seeing a do not resuscitate order on the fridge, and I just didn't understand it. Honestly, I wasn't even that young. I just saw it and I'm like, what is the purpose of that? I don't actually get it. I have since learned, and yeah, this is a big reason why. It's just not worth it in a lot of cases. Story 14. I used to be a nursing student. I decided to drop out in my second year because it wasn't where my heart was. During my placement at the city hospital, I got to talk to an older man. He must have been like 88 then. He was talking about how I look exotic and always complimented my long hair, etc., etc. I was never threatened, though, or put off by it. One day he told me I looked like the woman he wished he never let go of. That he was completely happy about how his life turned out, loved his family and late wife, but he always thinks about the woman he shouldn't have let go by. Years later, I met a guy at work who ended up moving across the country for work. I remembered this old man and followed my heart. I never let my love get away. I married him this summer. You should always try. Even if it doesn't work out, go for it and find out, so you never wonder. On the flip side of this, I bet there are plenty of people out there who are on their deathbeds being like, I shouldn't have wasted so much time chasing this person. But I guess chasing the person isn't exactly what they're talking about here, so fair enough. Story 15. I worked in long-term care for 12 years. I remember a married couple that shared a room. She had cancer and kidney failure. I was helping her eat lunch one day with her husband sitting there with us. She looked like death, but her husband looked at her and then at me and said, "Have you ever seen a more beautiful woman?" I had to leave and go to the bathroom and cry. I cried for days every time I thought of what he said. I thought I would never know what it was like to be loved like that. I had been divorced for years. I couldn't tell the story without tearing up. Footnote, I was divorced 23 years when I met Rod. Been together for 11 years. I know that love now. It's never too late. Story 16. He was one of my first patients as a nursing student, named Frank. He was 92. After knowing him for a few days, he disclosed to me that his regret was outliving everyone he had loved. That he and his wife hadn't had kids, and that he was all that was left, and that he wanted to see his wife again. I wasn't sure how to respond, so I just listened. And it made me realize how living so long isn't great if everyone you love is gone. He passed away later that week, and while I distinctly recall some of my classmates being upset, I felt relief for him. I knew that now he was where he wanted to be. I've had many patients since, but you tend to remember your first. Other than that, ditto to what everyone else is saying. More time with family and loved ones, wish they wasted less time with work or other BS, etc. Story 17. I've taken care of a lot of COVID patients and seen a lot die. I had a lady who lived in an adult family home. She was 100% cognitively sound. Her adult family home had a COVID outbreak and she caught it. She spent weeks in the hospital and eventually put on end-of-life care because she declined. She was kept heavily sedated on a PCA pump to ease her transition. One night I heard her IV beeping and it was the line occluded alarm. When you work with the dying population on these pumps, you learn the occlusion alarm will sound when the patient dies. This is because there's no blood flow. There I stood outside her door listening to the alarm. I sighed and told the nearest CNA to wait by so I could tell him a time of death. I don my PPE and go in and she's still alive. So I restart her pump and stand there for a minute, listening to the hum of the HEPA filter. I realized throughout her entire stay at the hospital she wasn't allowed a single visitor. She's gone through this entire experience alone. I grab a warm washcloth and start wiping around her eyes. The moment the warm cloth touched her skin, she whimpered and leaned into me, and then sighed deeply. She opened one eye and gave me a very quiet, very slurred thanks, and then her daughter's name. Then she says, "I should have spent more time with you." I left the room and cried for the first time since the pandemic started. She died a few days later. Story 18. I worked security in a hospital. In the ER, we had to sit with any 5150 patient so they wouldn't escape. In CA, that's threat to others, threat to self, gravely disabled, a legal hold that they cannot leave. I had, I think, a 17-year-old girl that came in on a Tylenol overdose. I normally don't listen or really even get invested with patients, because it's usually the same faces on a loop. But she kept trying to strike up a conversation, and eventually I relented, and she told me how stupid she was, and it was over a boy, and where she was going to college and what she wanted to do, and basically her life story. Taking a break to cry for a second. I left and she was stable in the ER. Next day I came in and asked if she went home or if she was in inpatient unit. They told me she died a few hours after my shift. It's been like 5 years, and thinking about it, I start crying like a baby. I don't cry. I think the last time I cried other than this was my grandpa passing, but even that I can discuss without crying now. Her death is the only thing that completely breaks me down. You may have heard my voice crack at the end there, and I assure you, something was just caught in my throat. But yes, of course, this story is incredibly sad and everything, and very touching and very sweet, but no, I am strong, I am a professional, and I do not cry on the job. Story 19. I'm a physician trainee who has done a decent amount of palliative care. I have been privileged to hear so many stories and be part of many deaths, but I still can't explain why it is certain lines that remain with me and hit me so much harder. There was a gentleman who told me, "Not yet. I can't die yet. I still have so much growing to do. I want to see my children and grandchildren grow up." And he was in his late 60s, early 70s. It made me reflect on how I view patients in this age group. Yes, much older than myself, but still with growing and living to do. I also think of a woman in her 50s I met early on in my training. She and her female partner had never married, partly due to laws and partly because it never seemed important. When she was diagnosed with metastatic pancreatic cancer, they regretted never making that step. I attended their small wedding in the hospital. She died a few days later. Story 20. I've been a nurse for 14 years, but one thing that still hits me is a 14-year-old boy fighting cancer. Did the transplant, but died fighting the side effects of that transplant. I've nursed him for almost a year, and we had grown very close. The day he went back to his home country in the US, I told him I am his big mama, and when he returned, we would do so many things together. His dream was to be a doctor, so I told him I would quit my job and be his nurse the moment he becomes a doctor. On the night before he and his family left, my husband, a chef, cooked for the family, as well as for all of the nurses, and gave him his favorite foods. My husband taught my patient on how to cook the recipes. My patient also loved to cook. We had dinner together and I was crying my eyes out afterwards. He was like a second son to me. His last words to me were, "I will make sure to meet you again." The day I found out from his mother he passed away, I was devastated. Story 21. I did 1 month elective in palliative care when I was a student. I actually enjoyed doing it. I did my best to make people feel as comfortable as they could in this difficult time of their life. I felt it was very rewarding. I met a lot of different people at the end of life, and biggest regrets/best memories conversation came up often. I would say top 3 I heard the most were 1. Shouldn't have spent so much energy on negative emotions/hatred, as the things that made me angry now seem completely trivial, and I wish I spent my time being more happy and positive in life. 2. I should have worked less, worried less, and spent more time doing the things I like with the people I love. 3. Having kids. Many people who didn't have kids said it was their biggest regret to not give it a chance, never found the right person, realized it was too late, etc. I would say not meeting my grandkids or not being there to see my grandkids grow up came up often too. I heard a lot of different stories which are specific to certain people, but those 3 by far were the most common. I also heard a few times, "I liked this guy or girl when I was young. I should have been brave and asked them out. Life could have been so different. I'll never know unless I tried." One side note too, I saw many people deal differently with death. Some were very brave and stoic. Some were very anxious, scared, and some just full of hatred for life because they felt they were being cheated. In the end, all of them died, and I felt really bad for the people who spent their last living days in such anxiety or hatred. I really feel like it's not a nice way to go. I always told myself no matter how or when I go, I will do my best to face it with courage and be cheerful until the end.